Good morning and or afternoon to everyone. This is Megan Renner from the United States Breastfeeding Committee, and welcome to our 30th bi-monthly Coalitions teleconference. Today's teleconference and or webinar we will be doing in the usual method, where we will have all of the presenters speak first, and then we will have a Q&A session at the end. Just a quick reminder to everyone of how we do that. On your webinar screen, you should have a questions box as part of the toolbar that appears. If the questions box is not open right now, you might see a plus sign next to the word questions, and you just need to click your mouse on that plus sign and it will expand it and open it for you. And in there, you can type in your questions and send them to us. Because we have actually 4 presenters today, we would ask that, if possible, you try to let us know which presenter you're asking your question of. So you can just type their first name in, or if it's for all of them, you can say question for all. But that will help us to organize the questions a little bit more at the end. So again, we will be doing questions at the end, but you can feel free to type them into the questions box throughout the webinar, and we will do the Q&A session at the end. So without further ado, I'm going to turn it over to Chris Mulford, who will be moderating the webinar today. Chris, as many of you know, is the chair of USBC's task force on the nursing breaks law and does many other things for USBC, including coordinating and liaising to many of our partners that are working on this issue of paid family leave. So Chris, I'll turn it over to you.
Thanks very much, Megan, and I'm delighted to be here. I really appreciate this opportunity to introduce to my colleagues at the state breastfeeding coalitions 3 people from the world of work and family advocacy. So could we see the next slide? And that would be Eileen Appelbaum, who is from the Center for Economic and Policy Research in Washington, and Karen White from the Center for Women in Work at Rutgers, the State University of New Jersey, and Vicki Shabo from National Partnership for Women and Families, which is a non-governmental organization based in Washington that has been working on these issues for decades, believe that. And so we'll be hearing from each one of them. Yes, I'm Chris Mulford, and I'm lucky enough to live kind of on the state line between Pennsylvania and New Jersey, so I've worked in both states, and I'm on both state coalitions. And that's where I was able to learn about paid family leave and to be the representative from the New Jersey Breastfeeding Coalition to the New Jersey Time to Care Coalition, which you'll hear more about. California and New Jersey are the only states that have paid family leave in our country, and that means you get part of your wages replaced when you take time off to care for a seriously ill family member or to bond with a new child in the family. So we'll be talking about those 2 programs in New Jersey and California today, but also Vicki will point people to initiatives and campaigns that are going in several other states as well. Because my goal with this webinar is to let breastfeeding advocates know what's going on in paid family leave, because there are a lot of things going on around the country. And certainly in New Jersey, I think we found the association between the Breastfeeding Coalition and the Family Leave Coalition to be mutually beneficial. Next slide. So just a review of family leave in the United States. We have the federal FMLA, Family and Medical Leave Act, that was signed in 1993, and it's unpaid. It's 12 weeks, and it only applies to people who work for large companies. The California paid family leave does replace wages partially, and it passed in 2002 and became effective in 2004. One state that I left off the slide, and Vicki called that to my attention, Washington State in 2006 also passed a paid family leave bill, but they don't have funding for it, so nobody actually is able to take it. And then New Jersey, that bill passed in 2008 and is effective in 2009. Next slide. This is my final slide, and this is kind of the devil's in the details slide. The main point of this slide is to show you that paid family leave is not a monolith, and when there's a campaign going on in the state, all of these issues are getting discussed with the legislators and the unions and the employers associations and everybody else who has an interest. So some of the issues that come up, and what you may hear about in the talk today, is who's eligible for the leave, and is it gender neutral, which is that's something we do in this country. Many other countries have maternity leave and paternity leave, but we have just general family leave. How's family defined? Which family members with a serious illness can you take this leave for? The fact that bonding is given as a reason for the leave is really exciting for us breastfeeding advocates, because we, of course, see bonding as a code word for, oh, good, she can have time to establish breastfeeding. But it does also apply to bonding for the dad and to bonding for adoptive parents. So I don't care what they call it. If they want to call it bonding, that's fine with me. We know that it really helps with breastfeeding. Whether your job is protected while you're on leave is important, because otherwise it's possible to lose your job while you're out on leave with your new baby. We've discussed paid versus unpaid, but the length of the leave, of course, is something to be negotiated, and whether intermittent leave is possible. Obviously, for a new mom, it would be great if she could, say, go back to work full-time but take every Wednesday off for the first few weeks or the first few months, so that she doesn't have a long period away from the baby and she can rebuild her milk supply every couple of days. Is there a waiting period? And some states have a waiting period. You don't get your full wage replacement. You just get some of it. Very important is who pays into the fund. And both of California and New Jersey, the leave is funded by the workers. The employers don't have to pay, which is a great selling point with them. But employers complain anyway that, oh, if she's out taking care of her spouse, then she's not here at work. So this is a problem for them, and that has to be dealt with. And then the size of the business. Small employers may find it more difficult to comply, and so sometimes they're excused. We're familiar with this from the nursing breaks law, aren't we? So that is my just little laying the groundwork, and now we should move on to Eileen to tell us about California.
Okay, can we get these slides up?
Bear with me for just a moment. I have to switch.
Okay. Well, thanks everybody for inviting me to speak to this group. I'm going to be talking about a report that I did with Ruth Milkman. We looked at California paid family leave 5 years after it was implemented, and we did this by surveying employers and separately surveying workers in the state of California. And we also did follow-up interviews with a subset of employers and with a subset of the workers who have been interviewed. The report is available. It shows on your screen exactly where you'll be able to get it. So I hope that you will take a look at it. Can we go to the next slide? Just bring everything up. So I'm going to talk about the business impact briefly. I only have a few minutes. I'm going to talk about the benefits to working families, and especially what it has done for breastfeeding, and I'm going to talk about the use of paid family leave by men. It is available both to care for a spouse, so a man can take it after his wife gives birth to a child to help care for her and the child. And it also encourages fathers to take some time off to bond with the new baby, which I think most people find to be important. Next slide. So businesses initially, of course, objected to the paid family leave. They said that it was going to be a job killer. This is, I'm sure you're familiar, everything we have ever thought about that could benefit employees, even if it was going to be beneficial to society in general, has been denounced as a job killer. So that was really important. We needed to find out about that. The second point is that business lobbying led to scaling back the original proposal, and this I'm really disappointed in. The initial idea had been 12 weeks of paid family leave with the cost shared between employers and workers. And when employers would not pay, then the advocates said, okay, then we'll just go for 6 weeks paid for by workers. But it turns out that the cost of paid family leave is so small that, in fact, it would not have been a burden to have the workers handle the entire 12 weeks. And for reasons that are too complicated to explain in this discussion today, economists will tell you that it doesn't really matter how the law is written. Employers, if you force employers to pay it, they will shift those costs to workers if the workers are less skilled, and they will absorb them if the workers are more skilled. So it's really not as big an issue as you might think. Businesses also, as Chris pointed out, voiced concern over costs of covering the work of those on leave, and they were concerned about the potential for abuse, and they claimed that the burden would be especially difficult for small businesses. So we looked into all of these things in our survey, and on the next slide, you'll see what we found. So let's have everything. What they found is that 89%, basically they found that it was a non-event. Mostly what they told us is no noticeable impact. So 89% of employers said paid family leave had no noticeable effect or a positive effect on productivity. 91% said the same for profitability. 93% said that it reduced turnover or had no noticeable effect. 99% said that it had no effect or a positive effect on morale. There's been some concern that coworkers would object to this because the work is often shifted onto them, but we did not find that either in the employer survey or in the worker survey. In fact, everybody understood that they might need the same help at some point in their lives, and for the short period of time, the 6 weeks maximum, were willing to shoulder the extra burden. It turned out that there were even fewer negative effects on small business. Small businesses have always said to us, we're like family, we know our employees, we know their children. If a kid gets hit by a bus, we want that mother or father to be home with that child. And the small employers reported even fewer negative effects. And 5 years, with 5 years of experience with paid family leave, we asked the question directly, any employee for whom you are responsible ever abused the program? And 91% reported no knowledge of such abuse. And those who had some knowledge of abuse, it was generally an isolated event. Next slide, please. So, of course, our whole interest in all of this was to hope that it would help workers, and especially we hope that it would benefit workers in what we consider to be poor quality jobs, jobs that pay less than $20 an hour and do not have health benefits. And for those jobs, for workers in those jobs, the paid family leave really made a difference. Our biggest problem in California is that the workers who need this leave the most are the least likely to know about it. And we have to do a lot more around public education to make sure that workers in low-paying jobs, in unskilled jobs, in part-time jobs know that this is available. The law in California is written in such a way that nearly every private sector worker is eligible. There's no carve-out for small employers. You only need a minimum number of hours of work in the previous year to be eligible. We wanted to have anybody who was working and needed this be able to take advantage of it. And we found that those who used it had higher rates of wage replacement, were able to take longer leaves, were more satisfied with their leaves, were more likely to return to work for the same employer, which is important to employers, and that the care of new children or the ill family member was enhanced by using paid family leave. Next slide. We were especially interested in what happened to the median weeks of breastfeeding. While I think all of us would like to see mothers breastfeeding for even longer than these numbers suggest, what it says is that the median length of breastfeeding, it doubled. And especially for women in low-quality jobs, half of them used to stop breastfeeding before the 5th week. Now they breastfeed until the 9th week. And they are, I can't shut this off, I'm really sorry. Okay, anyway, I'm sorry about that. So you can see that they increased the amount of breastfeeding, and it's unfortunate that we did not get the 12 weeks of paid family leave, because the longer the leave, the more likely it is that the mother successfully initiates breastfeeding and continues it for a longer period of time. Next slide. One of the great things about it is that men are eligible as well as women to take these leaves. And as a result, you can see that men have been taking the leaves. The red line is the leaves for caring for an ill family member. This is men taking care of their spouse. Also, the FMLA does not allow you to take time off, have job-protected time off to care for your in-laws. So you can't send your wife to care for your mother if you're a man. And so we see men taking these leaves. About a third of the leaves are being taken by men. And now what we see is, if you look at the bonding leaves, in the time that they've been paid and the wage replacement is fairly generous, we find that the proportion of men taking making such claims has increased steadily. So we consider that to be the good news on this. And now I think I'm up for the final slide. No, so I did include the one on unequal awareness. You can see here the point I was making earlier. It is mainly foreign-born workers, low-paid workers, Latino workers who are the least aware of the paid family leave. And in general, less than half, about 49% of workers overall knew about it. So we do need to do a better job. Okay, and finally, so the U.S. is one of just a handful of countries without paid maternity and bonding leave. Being able to return to work after having time off from work after childbirth increases the likelihood of breastfeeding. So we need to improve that and make it available generally in the U.S. We need to provide adequate wage replacement so new mothers can afford to take time off. And as you might know, the FMLA extends job protection only to workers working in companies with more than 50 employees. We need to extend these job protections to all workers. Thanks very much.
Okay. This is Karen White. It's really great to be on this panel, especially with Eileen and Vicki and Chris. I'm really pleased to be here talking with you all about family leave insurance and how in New Jersey, the Time to Care Coalition and the New Jersey Breastfeeding Coalition helped to make it possible, and how you can help raise the awareness of the importance of this issue in your state. I'm going to start with an overview of the legislative history of New Jersey's leave program, and then I'll talk a bit about the program, how it worked, and finally I'm going to talk about the Time to Care Coalition and the New Jersey Breastfeeding Coalition and how we work together on this issue. New Jersey's family leave insurance program, the idea first started in 1996. There were many proposals and bills considered by policymakers, but none of them really got the support they needed to move through the legislature. So then in 2002, when California passed its family leave program, folks saw an opportunity to do the same in New Jersey. California had crafted its program as an expansion of its temporary disability insurance program. For those of you on this call who are not familiar, very quickly, there are only 5 states that have a temporary disability insurance program, plus Puerto Rico. Those programs include maternity leave. So by crafting a family leave insurance program as an expansion of an existing temporary disability insurance program, policy makers were among other things, able to minimize the financial resources that would have been necessary to create a program from scratch. And as we all know in this economy, creating a public program without some appropriations is fairly hard to do. But this was an easy task for New Jersey legislators. So as a state with an existing temporary disability, they moved forward. They drafted the legislation, and it was introduced in 2005. The legislation went through numerous committees and other hearings, and like California, the original legislation called for 12 weeks during the process of committee hearings and other negotiations. That got whittled down to 6 weeks. The final bill was enacted into law in May 2008. This effort took over 12 years of a strong, diverse coalition for it to become law. That's really important. No policy or very few policies go through very quickly. It usually takes a bit of time for them to go through the process. So we'll move to the next slide. And I'm going to talk about how the program works. As Chris mentioned, this is not a leave entitlement. The entitlements and job protections exist under other laws, FMLA primarily. This is an employee paid insurance program. It provides wages when a worker takes unpaid time from work to bond with a newborn or newly adopted child, or to care for a seriously ill family member. The partial wage replacement in New Jersey is 2/3 of an individual's weekly wages, up to a maximum in 2011 of $559 a week. This amount is adjusted yearly based on the cost of living. Most all workers in New Jersey are eligible, including those who work for small businesses. Businesses pay nothing. This is important, as Eileen pointed out. And it is, again, an employee-paid program. The most any worker pays into the system in 2011 is $17.76 per year. This amount is made to be adjusted each year based on uptake and usage of the program. So this has just been a quick overview of the most important elements of the program. You can find out more about the New Jersey Family Leave Insurance Program from the Time to Care website. I'll give you that information, how to access that website at the end of this presentation. So let's go to the next slide. And a little bit about the Time to Care Coalition. It was organized in 2003 in support of family-friendly workplace practices. Family leave insurance was its first priority. The Time to Care Coalition realized that central to any effort was the ability to mobilize grassroots level and build a broad-based public support. So they started reaching out to organizations, and over the years have grown the coalition to over 70 organizations representing women, families, disabled, elderly, mothers, children, researchers and academics, unions, and small business owners. By building a broad-based coalition, they were able to effectively counter gender bias associated with this type of program, which was really important, and to move the debate from it being a women's rights issue to a workers' rights issue. The coalition conducted a multifaceted, multi-year campaign involving strategic messaging, outreach and education, a statewide poll. A state poll was important, although there's national polls out there. Having something that shows support within the state was useful in talking with policymakers. Research was also very important, adds to the credibility of the state campaign, and is a powerful tool when coalition members talk with legislators. They conducted press events, held editorial board meetings, provided testimony at legislative hearings, personal stories about people who needed the leave, and of course they identified key legislative supporters. So let's go to the next slide. The New Jersey Breastfeeding Coalition was very central to this work. They joined the campaign early after the legislation was introduced. They participated in every aspect of the campaign, and they were very important in highlighting the importance of the health benefits to mothers and newly born children. In much the same way, having a diverse coalition moved the debate from a women's issue to a workers' issue. This moved it from a women's issue to a health issue, which was very, very important. They attended coalition meetings and events. They provided outreach and education, appeared in press and on TV, provided testimony at legislative hearings, personal stories, and attended meetings with legislators. And so let's go to the next slide. So what's next in New Jersey? Right now we are working on a two-year analysis of the family leave insurance program, and we're conducting some expanded outreach and education on the availability of benefits and how to access them. In fact, we've just produced a brochure in both English and Spanish and are working with the area WICs to have those brochures made available to their participants and to attend meetings with folks who go to the WICs to tell them about the program and how to access the benefits, and to answer any questions that they may have. We're also working on a campaign for paid sick days for all New Jersey workers currently in New Jersey. 1.5 million of New Jersey's workers are without paid sick days, so we feel that's a very important next step. So that was very quick overview. I hope I didn't overwhelm you with too much information. If you have any questions or want more information after the session, you can contact me. My contact information is there. Email kswhite@work@rutgers.edu, and the Time to Care Coalition's website is www.njtimetocare.org. And I'll now turn it over to Vicki.
Great. Thank you so much. It's such a pleasure to be here, and thank you to Megan and to Chris for organizing this, and it's always great to speak with to follow on Eileen and Karen, who have been working in this area and done so much work for such a long time. My name is Vicki Shabo, and I direct the Work and Family program at the National Partnership for Women and Families. It looks like we need slides brought up first. But while that's happening, I can tell you a little bit. The National Partnership for Women and Families is the organization that worked 40 years ago nearly to get the Pregnancy Discrimination Act passed, to pass the Family and Medical Leave Act in 1993. And we continue to press for national policies for both paid family and medical leave, as well as paid sick days, which will provide paid time off for shorter and more routine illnesses and preventive time off. And I can talk a little bit about those two policies. We also provide technical, strategic, and legal assistance to state and local advocates and campaigns. So we work across the gamut of work-family issues and across the national, state, and local levels. I'm pleased to round out this webinar to tell you a bit about what's going on at the federal level and at the state level and how you can engage. So we can go to the next slide. So just to provide an overview, at the federal level, I'm just going to talk briefly about what's going on in terms of appropriations and also national introduction of a paid family and medical leave bill. And at the state level, I'm going to touch briefly on bills and campaigns for paid family leave and bills and campaigns for paid sick days. And the reason I'm talking about paid sick days, or just want to flag that, is that a lot of these coalitions in the states, as Karen was talking about with the New Jersey Coalition, work on both paid sick days and on paid family leave. And so even if the coalition in your state at this time is primarily focused on paid sick days, as many of the state and local coalitions are, those are probably the same folks that are going to be instrumental in a paid family and medical leave effort. And so all of these issues really complement one another and fit together to create the kind of policies that we believe 21st century families, and particularly 21st century working women, need. So next slide. At the federal level, a couple of things to flag. One, the Obama administration for the last 2 years has proposed that a state paid leave fund be created within the Department of Labor. And this fund would support and promote innovation in state paid leave programs. Now, we all know the budget cycle is kind of messed up here in Washington, and the appropriation cycle is totally off track, and that this is an environment in which it's difficult to get new appropriations for things, even when they are small amounts of money, like the $23 million that the administration proposed this year for state paid leave. Nonetheless, it is critical for federal legislators to hear about this issue. So what you can do is contact your own federal legislator to ask the folks on the Appropriations Committee to support the state paid leave fund. And if you're interested, your state breastfeeding coalition can also sign on to a letter that we have from national, state, and local groups in support of the state paid leave fund. So you can get in touch with me. My address is email address is at the end of this presentation if you're interested in signing on to that letter. I believe we actually have a number of breastfeeding coalitions already on the letter, and you all have been terrific supporters, not only to us at the national level, but also state and local campaigns that already exist. So that's the state paid leave fund. We are also expecting to see a national paid family and medical leave insurance bill introduced later this year. Representative DeLauro from Connecticut and Representative Stark will likely be introducing that bill sometime this fall. Once that bill is introduced, I'd urge you to ask your legislators to co-sponsor the bill, and we'll almost certainly have a letter of support that we'll send up to the Hill. And so I'll be in touch with Megan and with Chris to try to urge you all to sign on to that letter as well. We also work at the federal level on paid sick days, which is, as I said, would require businesses of a certain size to offer their employees the ability to earn paid sick time up to 7 days a year. We have a sign-on letter for that as well, and so you may be hearing more about that as time goes on too. So next slide. At the state level, a number of states, 4 states have had bills introduced so far this year. These are states in which the bills have been introduced, but there are not currently active coalitions working on these issues. So what you can do is contact your legislators in support of these bills and consider whether this is something that you might want to get involved in terms of helping to jumpstart a coalition and really launch an aggressive effort for state paid leave. I will say there were more campaigns last year. There were very active efforts in Oregon and in Washington State to get their paid leave. So in Oregon to start a paid leave program, in New Hampshire to start a paid leave program, and in Washington State to get their program funded. And the policy, economic, and political dynamics from 2010 and now have really sort of put those efforts not on the back burner, but certainly caused caused those efforts to stall just a little bit, but those are states in which there are very active and engaged coalitions, and I would expect to see those places as well as others take paid leave on again very soon, as soon as the political climate changes and the state budget situations improve a little bit. On the next slide. So as I mentioned, there are state paid leave campaigns going on in these places. In New York, there's an active effort to get a bill introduced and considered this year. As I mentioned, Oregon and Washington both have very strong coalitions. They don't have legislation this year, but I think they will have legislation again. But those coalitions are doing a lot of work to gather new advocate supporters, and especially in Oregon to get new businesses. And as I mentioned, New Hampshire also had a very active campaign. They have the support of children's groups as well as some businesses, and I would expect to see those fire up again shortly. Next slide. I also just want to mention really quickly, because a lot of the work family coalitions are working on paid sick days right now, this map shows you the states and cities in which there are active paid sick days campaigns or where bills have been introduced. And again, this is just a good opportunity to plug into the folks that work on these issues to try to get some basic standards in place and to really raise the salience and the profile of issues around work and family, and particularly what working mothers need to succeed at work and be good parents. I would expect in 2012 to see a number of other cities in particular take on this issue, so stay tuned for that. And then next slide. So in short, how you can get involved. You can connect with existing campaigns and legislative champions on both the federal and state level. You can build on existing networks to start coalitions and invigorate coalitions that already exist to make them stronger and more diverse, and to really bring the voice of working nursing mothers to the table. And you can talk to state legislators who are active on other work and family issues, on other workers' issues, and on other health issues to champion paid leave and other policies like breastfeeding policies and others that support working families. To learn more, especially on paid leave, you can go to www.nationalpartnership.org/paid-leave. On paid sick days, you can go to www.paidsickdays.org. And I believe my email address is on the next slide. And you can always contact me at vshabo@nationalpartnership.org to learn more about any of this. We have a number of fact sheets on our website on both paid sick days and paid leave, as well as on workplace flexibility. We have some materials, and so I really would welcome hearing from any and all of you on plugging into both the federal and state and local efforts.
All right. Well, thank you, Vicki, and thank you, everyone, for your wonderful presentations. This was great information. And I just wanted to remind folks we do have time for question and answer now. And you, again, can click the little plus sign next to your questions box to type in your question there, and I will try to consolidate them as much as possible. If you can, also, if you're directing your question to a specific speaker, please let us know when you type it in as well. So let's see. First question I have, what is being done, if anything, to promote bringing breastfeeding infants to work? I don't know if that's a factor in any of these campaigns.
This is Vicki. I have not heard a ton about that with respect to the paid leave and the paid sick days sites, because those are really about giving workers the time and space to be able to stay home. I do know that there are a number of companies, and I'm sure many of you may know this better than I, but a number of companies that have explored Bring Your Baby to Work programs very successfully and have great results.
Yes, and I can just add that I actually met with the folks behind the babiesatwork.org website last month, and if you folks are not aware of that, they do have an organization called the Parenting in the Workplace Institute, and a lot of information on that website about the companies that already have those programs, as well as information for companies that are interested in starting those programs. So I would encourage folks to check that out. It's babiesatwork.org. Let's see. So I have a couple more questions. Have you learned any lessons from the U.S. military, which offers servicewomen 6 weeks of fully paid maternity leave, or from the Marines, which offers 10 days of daddy leave?
So this is Karen. I'll just say, you know, what Eileen also said. Ideally, we wanted to see 12 weeks of paid time for mothers to bond with their mothers and fathers to bond with their newborn or newly adopted child, or to care for a seriously ill family member. The fact of the matter is the U.S. is one of, I think, 4 or 5, I can't remember how many, countries that do not have a paid leave program. And those countries are, I think it's Papua New Guinea, Swaziland, Liberia, and the U.S. Eileen probably knows this better than I do. We need to bring the U.S. into the 21st century and to have paid leave. The military is a good first step, but we need to make it available for everybody.
Just wanted to remind folks, if you have a question, do go ahead and type it into the box. I actually have a question for you because I was hearing the part you were mentioning that the National Paid Family and Medical Leave Bill will be introduced in the fall. Is that for all workers, or is it just federal employees? I just wasn't clear on that part.
Yeah, this would be a bill that would affect nearly all workers. So right now it's patterned off, the current proposal is to pattern it off of those who pay into the Social Security system and would be eligible for Social Security disability insurance. It's a draft that's in the works, so that may change, but it would be for all workers. Megan, just to piggyback on what you said, there is a bill that has been introduced in this Congress, as well as it passed the House in the last Congress, to provide 4 weeks of paid leave to new parents who are federal employees. But the bill that is being discussed for this year to be introduced, this bill would apply to nearly all workers.
Wonderful. Okay. Any advice that you all might give us in terms of messaging about this, given the current state of the economy? We have a couple of questions about any advice or lessons that you have learned in terms of making the case for this when talking with legislators. We all know the value, but in this climate, any advice that you have?
So this is Eileen. What's been really, really important about the study of California paid family leave is that it shows that there has been no increase in cost for employers. Employers report, nearly all employers, I shouldn't say all, but nearly all employers report no increase in cost, and many of them, especially the good employers, have a reduction in costs because they are able to coordinate their company benefits with the state benefit, so that they do not need to cover 100% of an employee's pay when they're out. So if the state is covering, as in the case of New Jersey, 2/3, or in the case of California, 55% of the employee's pay, then the company only has to top that off to get up to 100% if that had been their policy. So there are cost savings from coordinating your benefits, and also both the employer survey and the employee survey showed that workers who have paid leave are more likely to return to work with their original employer. And what many companies know, and certainly what the research shows, is that the costs of turnover are so much higher than the cost of paid leave. It could take you more than 6 weeks to fill a job if an employee leaves. So it's really important both for employers and for employees that we have these kinds of policies in place.
So I'll just add to what Eileen just said and say that for in New Jersey, messaging around it being an employee-paid insurance program was very important. There was a lot of talk about it being or the business portrayed it as a a leave mandate when in fact it was not. There are no job protections. It is an insurance program only. It is an employee paid insurance program. And once that's understood, people, the legislators were more supportive, knowing that it was not mandating a new program on businesses.
And I'll just add one additional thing, and that is small businesses. It is possible to get them to be part of the coalition because they understand that what this does is it levels the playing field for them. In a state like New Jersey, where you have J&J and a lot of other employers that are known to be family friendly, that can have deep pockets and can afford good benefits, it's really hard for an IT startup or a biotech startup to compete for top talent. And one of the things that they now can do is if they hire someone, even if they cannot afford a short-term disability package for their employees, they can say, well, you know, in New Jersey, you get short-term disability, so that counts as paid maternity leave. You get paid family leave. We have all these benefits in the state, and this has leveled the playing field for those small employers. It also, as I said before, a lot of small employers think of themselves as family and were willing to give workers time off if their kid got hit by a bus or their husband had a heart attack, but they didn't have the deep pockets to be able to pay them while they weren't working. And this takes that pressure off the small employer as well.
Wonderful. This is a question for Eileen. How is the California paid leave funded, by employers or employees?
By employees only. That's why they ended up with the 6 weeks instead of 12. When the employers objected to paying for it, they said, okay, we'll pay for it ourselves. And you saw from Karen how cheap it is. They should have said, we'll pay for the whole 12 weeks ourselves and set that as the standard. It was really hard in New Jersey to get more than 6 weeks after California set the standard, so to speak, and accepted 6 weeks.
And so a related question, is the national bill that we were just talking about pushing for 12 weeks or just 6?
12 is the current proposal, so that it would match the length of time people can take under the FMLA.
Okay.
That's what's in the draft. And I would expect that length would stay where it is. And the federal bill right now proposes to split the cost between employees and employers.
Okay. And they're also asking, how often can the workers take this leave? Is there a limit at all?
So in New Jersey, you have the first 12 months of a child's, 12 months from the birth of a child to take the leave, but it is in 1 week one week periods only, so you're limited to taking it either in a 6-week period or more than 1 week period. But you have for bonding, you can take that leave up until the first birthday of the newborn or newly adopted child.
Yeah,
it's slightly different in California. I think they can take 1-day increments.
Right, they can do that. And what we found in California is that the mother will take the full 6 weeks at the time the baby is born. She needs every minute of that to recover. The father will take a little bit of time at the beginning, but he is available if the baby gets sick or other things emerge where she has no more time off, but he would have access to some paid time off. And so the father will often take a few days if the baby is sick. The answer to the question, though, is a little bit more complicated because both New Jersey and California have a patchwork of laws. So you can take off time to bond with the baby in the first 12 months, and you're supposed to only get up to 6 weeks. Well, the FMLA is up to 12 weeks in any 12-month period. But in New Jersey, they have another law. So if it's not for bonding, but the baby is sick, or another relative is sick that is covered by these laws, you get time off. In California, they have other laws that, in fact, if the employer will hold the job for you, would give you up to 14 weeks off. So there's really a patchwork of laws out there that are very complicated to decipher.
It really
Sounds
depends
not
on
unlike our issues with the breastfeeding workplace law and all of the different state laws.
Right, exactly.
And not unlike the arguments that we use making the business case for breastfeeding. So lots of areas here. Piggybacking on the dad question, how can we encourage more dads to take the family leave for bonding, as it is such a help to new moms?
Well, so the California program is less generous to low-wage women who take the leave, but it's capped at a much higher level than the New Jersey one. And this makes it easier for fathers to take the leave. Fathers usually are the main breadwinners. They still earn more than wives in most families, although this is changing. But to the extent that that's true, it's really difficult for a father to take off if it's capped at $559 a week. If he's a unionized worker making $1,000 a week, or a professional worker making $1,500 a week. So we have more fathers bonding with babies in California than New Jersey, because at the top, the California program is a lot more generous. So what's good about both programs is that each parent has access to the full 6 weeks, so that's a plus. But the other piece of it has to do with how generous the leave benefits are, and of course doing something about company culture so that men feel comfortable taking this leave.
Okay, here's a question that is always near and dear to our hearts. Where can we find resources that individuals could use to start a paid leave campaign? Toolkits, sample letters. I know you gave some of your websites. Anywhere in particular you would direct us?
So on the National Partnerships website at www.nationalpartnerships.org/paid leave, we have many fact sheets that look at, explain what paid leave is, look at it from through a bunch of different lenses and for different audiences. We are always available to help new campaigns get off the ground in terms of resourcing them with, sample letters or fact sheets or anything like that. The Family Values at Work Consortium works with about 15 coalitions in different states and also offers some sample resources. But we're really, I'd be more than happy to help anybody that needs sample information, sample letters, tools to get a campaign started.
And I would be also delighted to answer any questions that anybody has about how it actually works in practice on the ground level in a state. If you have any questions, or how to start off a campaign, or how we started off, be happy to answer any questions.
One other resource that might be helpful, and I know that Megan and Chris, you posted it on the landing page for this webinar, but the folks in California, the Labor Project for Working Families, and the Chef Center at Berkeley just did an analysis of paid family leave, how the program is working in California, and with some tips about implementation. There's an earlier report that the Labor Project for Working Families issued that's called How Paid Leave Was Won in California. I believe we have a link to it on our website. I'm sure you could also find it on the website of the Labor Project for Working Families. But I think that would have some good information. And one other thing that people might be interested in on the National Partnership for Women and Families website, on our website, is a research, a compendium of all of the existing research on paid leave that's out there. So you can find that through our research library as well.
Wonderful. And I will just add, we are midway through the process of updating our website to match the framework of, and this is Megan from USBC, to match the framework of the Surgeon General's call to action. So what we will try to do is make sure that we're linking to all of the resources that you all recommend from that paid leave page, so that they're easy to find for breastfeeding advocates. So I might connect with you guys to just confirm our links. But we are nearing the end of our time, so I want to thank everybody, for all of the speakers and everyone who submitted questions. I think we've hit everything that's come in, and you have the speakers' information as well if you have specific questions after the webinar. And again, the slides and handouts and all of the usual materials are posted on the USBC website. The audio recording will be posted usually within about 48 hours. That will go up as well. And you can link to that directly from our homepage. So you go to www.usbreastfeeding.org, and down in the right-hand side, there's a section called Quick Links, and there's a link right there to the bi-monthly coalition's teleconferences. And so that's where you can always find the materials and archives of all of these teleconferences. So I do want to turn it over to CDC. I know that they have some announcements for us as we have closed out World Breastfeeding Week. So, Larry, are you there?
Megan, these are a number of announcements that came out last week, but I think that just in case people missed some of them, I wanted to point people's attention to a few of these things. We had a very exciting World Breastfeeding Week last week with various things coming out. On Monday, there was an announcement from the Joint Commission of their Speak Up campaign, issuing information to pregnant moms about their hospital stay and what they should expect. And we hope that will be a driver of improvement in maternity care practices. Many people in USBC as well as here at CDC worked with them on developing that campaign. Second, HHS announced new preventive services for women's health. These are standards for new health plans under the Affordable Care Act that, effective August 1st, 2012, will require the payment for breastfeeding services and equipment without charging a copay to the beneficiary. This will be for new health plans. Many health plans will not be considered new at that date, but as the healthcare reform unrolls between now and 2014, many new plans will be affected by this new law, this new regulatory provision. Next, CDC did a major announcement last Tuesday of its Vital Signs series, in which we focused on the MPINC results and highlighted the importance of hospital changes to improve support for breastfeeding. Tom Frieden briefed the press on Tuesday, and we let out communication materials as well as an MMWR focusing on this need. I hope many of you were able to see some of the news articles associated with that. We also posted on our website the state reports for MPINC, so those of you who want to see what your state rates are for the various items within MPINC can download those from www.cdc.gov/MPINC. The hard copy of those reports will be going out to you within the next week or so. And the final announcement was that also last week we released the state breastfeeding report card for 2011, including the new National Immunization Survey statistics for infants that were born in 2008. The overall story there was that while we did not see an improvement in initiation of breastfeeding, stayed pretty much flat, we did see improvements in many of the breastfeeding duration indicators, each of them going up by about a percentage point. For a number of years, we've been saying that that was the indicator that wasn't budging, so we're quite happy to see some movement in the duration indicators. So that's all the announcements that I had from CDC. Thank you very much for your time.
Thanks, Larry. And I will just make a couple of very brief announcements from USBC. We did report and send out a bulletin email on many of the things that Larry mentioned. So if you have not seen that, that is also a good compilation with all of the links to many of those items. And please do check out the news box on our homepage at usbreastfeeding.org. We've posted several news updates there as well. Just a couple of very quick things. Many of you have already heard that the Breastfeeding Promotion Act of 2011 was reintroduced into Congress last week. I believe the night before they all went off for the August recess. So you will be hearing from us this week with the action alert and information about that, further details. Also, as we announced on Saturday, USBC did declare that August is now officially National Breastfeeding Month. So in addition to celebrating World Breastfeeding Week during the first week of August, we now can celebrate throughout all of August. So we're very excited about that. And looking forward already to next year when we will be celebrating in DC. As you know, we have planned to move the National Coalitions Conference to August for 2012. And again, those dates are August 4th through 6th of 2012. We will be issuing a formal announcement just as soon as we finalize some of the contracting and just the logistical details before. We like to do that before we make the formal announcement, but all of you can know and advertise that it is August 4th through 6th, 2012. And again, do check out the news box on our homepage. We'll be posting even more updates there, and even more things will be coming out on email in the week ahead. There's just been a very, very busy month already. So I won't go into much more detail today, but watch for that. And we will go ahead and thank everyone for joining us on this national webinar. And we will disconnect now and go on to regional calls. For those of you that are moving on to your regional calls, you can hang up and disconnect at this time and dial into the separate regional number. So thank you everyone for joining us, and we'll see you in October. Take care.